In this video, I'm going to show you how to do belly breathing from any position, okay? You could do it standing, seated, laying down, or in a tabletop position. It does not matter. So your first decision is, which position am I the least uncomfortable in, or perhaps even the most comfortable, okay? So find that position, again, seated, standing, hands and knees, laying on your back. In clinic, most people will respond the best to laying on their back. So I'm going to do it laying on my back first, but I will show you how to do this in other positions. If you already know you can do this in another position, any position that you're in, you're going to do the same steps. So find a position that feels comfortable. Again, standing, seated, laying on your back, or hands and knees. Your choice. We're all doing the same thing, except for hands and knees. You can't put your hand on your chest and your hand on your belly, obviously, but you can still sort of sense what's going on in the belly. So I would prefer seated or laying on your back if you had the choice. So what we're going to do is take one hand to your chest, let's say your left hand to your chest and your right hand to your belly. And all we're going to do here is take a breath in and take a breath out. Okay, now I just want you to sense which hand lifted more. Did your chest lift more, your left hand, or did your belly lift more, your right hand? Let's do it again. Take a breath in, pay attention. Which hand lifts more? Breath in and exhale. Okay, if your chest is rising and falling a lot, that is more of a sympathetic breathing pattern. Sympathetic means fight or flight. We want the opposite. I want you to breathe into your belly. I want your belly to expand when you breathe in. So I want you to inhale into your belly. Right hand lifts, left hand remains basically still, and then exhale, and the right hand relaxes and the belly softens back towards the spine. So you just continue this. It's not that complicated. I just want you to breathe into the belly. But if you'd like to level it up a little bit and really feel how core stability gets really overcomplicated. So what I'm trying to teach you is, how do you brace your core in a way that's pretty much effortless? Because core stability should be effortless. So now I want you to take your hands in little, like a C clamp, and then take your fingers and dig them into your low belly. Low belly. Don't go crazy, just a little poke in the little low belly is nice. And then the thumbs wrap around and press onto your back, okay? So from here, I just want you to cough for me once. Cough, okay? Or, and you feel how your belly presses out when you cough? Okay, so now I want you to create that same sensation with the breath in. So fingertips digging into the belly, take a breath in and create that outward pressure. So when you inhale, your belly expands out into your fingertips. Okay, big breath in. And when you exhale, keep that pressure and tightness in the belly. Okay, one more time, big breath in. Belly expands, pressure into the fingers, and now exhale completely. Okay, one more time, but this time on the exhale, you're going to do bursts of forced exhalation. So your exhales are going to go like you're trying to blow out a candle. Okay, one more time, big breath in. Breathe into the belly, pressurize, feel the canister of the belly become tighter. And then exhale, 3 forced breaths like you're blowing out a candle. Okay. Now, if that causes any pain or radiation or does not abide by our safe pain principles, then please do not do the more intense form of this breathing. Instead, just do natural belly breathing. But if it feels okay to you to have that contraction that feels like your abs are doing some work, then you're going to take a certain number of breaths, maybe 10 breaths, and you'll do those inhales just like we described. You inhale into the belly and exhale. And if you'd like, you can do the bursts. I like to do also one extended exhalation where the exhale is really long. So big breath in. And one long exhale. And then relax, okay? If that makes you lightheaded or you don't like it for some reason or it feels weird, skip it. Now, The reason we're teaching you this, by the way, is because that's the same breathing we're going to use when I get up onto my shoulder. I'm going to breathe in, pack the belly, exhale as I come up. As I stand up, I'm going to inhale, brace the belly, transition onto my hands and knees. Inhale into the belly, brace, as I stand up. There can be more steps to that. But the point is, any position, whether I'm doing this seated, standing, laying on my back, it's all the same stuff. I take my hands on my belly, inhale, right? I push my belly out, and then exhale, kind of forcefully. Okay? And it should feel like work. It shouldn't feel like crazy work, like you're doing, I'm doing abs, but it should feel like there's work being done across the belly. That's all it takes. It's not that complicated. And if it hurts, remember, just go back to normal belly breathing. Okay? That's it. You can do it in any position. Find a position that feels good to you. Take deep belly breaths. This is not only a good one for severe pain and to teach the fundamentals of core stability, but this is also, honestly, if you do this in a relaxed way, so maybe your problem, by the way, and this is important, so listen up. If you have a problem where when you're breathing with bracing, you get more pain, then definitely just relax. Use this as a relaxing breath. Instead of the forced exhalations, just exhale like you're fogging a mirror instead. So really peaceful breathing, okay? We still do generate some core stability, but we do it in a way that's relaxing. So now this sort of doubles as meditation. And then you can take 10 deep breaths anytime you either need a movement snack or anytime that you just need to relax. If you're feeling stressed, you're killing two birds with one stone. You're doing your exercise and you're doing a stress reliever. So look at you being efficient with your time, doing movement snacks that address both exercise and your stress. Yeah. Keep it up. All right. I'll see you in the next video.